Hello everyone. Today we will be talking about Boston Community Needs Assessment, and I will focus on smoking, drinking alcohol, and substance abuse among high school and college students. So here's an executive summary for this project. So Boston Community Health Assessment is defined as a systemic examination of the health status indicators for the population of Boston, and that examination helps in identifying the crucial problems, and it also aids the community in general. The eventual and ultimate goal of Boston Community Health Assessment is to state and address the strategies of development in order to know the needs of these community health and especially identified concerns, which in this case will be the substance abuse and drug abuse, which includes alcohol and smoking cigarettes. This assessment includes surveys and inputs from selected community members and secondary analysis of previously existing data and studies by utilizing method known as mobilizing for action through planning and partnerships, which is known as MAP. MAP is a process that is used for planning, evaluating, and improving the health of the community among many levels and many perspectives. This process is community driven. Here's a brief community description also. The chosen community of the final project is high school and college students in Boston. The topic of interest will be the drug use or the drug abuse, cigarette smoking, alcohol, and illicit drug among these community members. Boston is one of the big cities and the capital of Commonwealth of Massachusetts. It's located on the Bay of Massachusetts and the edge of Atlantic Ocean. The area of the city is 46 square miles. Boston has a nickname of the Bean Town. Boston is considered as the spiritual capital of the New England states. Boston is one of the big cities that has a huge diversity of education, culture, medical, and other activities among the whole state. Boston is located at the edge of two rivers, Charles and Mystic, and these two rivers are running through Boston. Inner Harbor. Boston is located by many important cities like Cambridge, Quincy, and Everett, and Revere. Boston was incorporated as a city in 1822, and it was one of the richest cities in the US. And it kept most of the original buildings that were classified as memorials that are included in the past of the United States. First public school in America was opened in Boston in 1635, but today Boston has about 70 colleges and universities. First European settler arrived in Boston in 1623 and it was named Boston in 1630. Boston became one of the developed cities list in the most advanced cities in economy, industry, healthcare, and tourism because of its historic heritage. It's also one of the first cities in high technology, biotechnology, and other electronics and softwares. The population of Boston reached the peak in the past 1950, but as many big cities, these numbers decreased year after year after that year, and it reached 600,000 and stayed like this for many decades. Last number was reported in 2009, by the way. The composition of Boston from race and ethnicity perspectives has been changed because the majority of residents were white in 1980, 70%, but the percentage dropped to 50% recently. Boston is one of the cities that contains a huge proportion of residents that are foreign-born compared to other parts of Massachusetts and the whole nation, but also this number is decreasing vigorously nowadays. Boston is listed among the largest cities that its population has the biggest foreign-born population. It is sixth among the 25 cities. In 2010, about 12% of households in Boston were fluent in English, and that increased from 10% in 2000. The growth of non-English speaking population indicates that foreign-born people has increased between 2000 and 2010. Here's the methodology that I will be considering for this final project, which is and this slide explaining some benefits or some pros of the map. So since I'm working in Boston Children's Hospital, which is located in Boston area, I was I always think and on my way to work when I'm passing by Boston Medical Center and specialized center near it that is responsible for treating of drug abusers and drug abuses. The second place that took my attention was the metro as a main way for transportation and its effect on population besides its benefits by providing transportation for a huge number of Boston's populations. In my work also as I met with the director of emergency department as we discussed the suicide among teenagers and the best way for screening and preventing the risky health issues. Beside also the main project which is uh, drug abuse. Ways to make children feel more comfortable of expressing their problems with their peers, families, and physicians were discussed throughout this meeting, and many solutions were suggested also. The sample of this study have shared and common characteristics which are specified by the research question and the health priority issues. Some of these characteristics that will be taken into consideration in this assessment are age, level of education, and socio-economic status, which includes also race and ethnicity. Since the focus and concentration will be about the substance abuse among high school and college students, among Boston community members, regardless their races and ethnicities, or any other socio-economic status indicators, the method of collecting and reviewing data will be by examining collecting surveys beside collecting data from the existing studies and research that talks about the health profile and health issues priorities. Here are some points about socio-economic status and demographics of Boston. I will mention some of them. Boston comes on the third level among the list of Massachusetts cities regarding the population number and the population changes between 2000 and 2010. That growth rate comes lower in the list compared to big other cities like New York, Houston, or San Francisco. Houston units and households average size has also increased between 1950 uh, and 19 and 2010, sorry. And the rate of population of foreigners among Boston population are higher than the people population in Massachusetts or other population among the other states. The percentage of people ages between 0 and 90 is 22%, and the highest percentage is the people among that ages 20 and 34 years old. The rates of education between 2000 and 2010 has increased also. Employment and unemployment rate among Bostonian people has increased between 2000 and 2010. The employment status by race has different rates among different races. Boston is considered as a big city like Dorchester and Roxbury compared to other smaller cities like Charlestown. And Boston also has a lot of micro-communities among its neighborhood, and those have their own characteristics, issues, and socio-economic indicators. In 2010, about half of Boston population were people originally from Boston, and this number increased from 32% in 1980 to 22%. And here's some points about the community health profile of Boston. Since the maternal and child health is a golden indicator for the city health status, Boston infants' death rates Low birth weight and preterm birth are important indicators for addressing the status of health in this city. IMR is one of the golden indicators, and this rate was high in 1990 for Boston, but it was low in Massachusetts. And Boston's rate dropped throughout the time till it met the rate of Massachusetts in 2005, which is 5.1%. IMR rate for the unit for the United States was reported in 2015 and it was 5.9%. The rate of parental care in Boston is approximately similar to the rate of Massachusetts, which is 8.4%. Other indicators for health problems and risk are the chronic disease rate, sexual health, rates of infectious disease, and the rate of substance abuse and violence rates. Also, cancer rate is one of them. The rate of people have no insurance coverage also is an important indicator for health access since people covered with insurance are seeking medical help and screening tests more than uncovered people. The rate of insurance coverage in Boston is 11.4 and it is 8.9 in Massachusetts, while it is 91.2 in the United States. The leading cause of death among Bostonians are cancer, heart rate, and all injuries and strokes, while these leading causes in the state of Massachusetts are heart disease, cancer, strokes, and all injuries. Approximately similar order for these reasons among the United States, and those are heart disease, cancer, chronic respiratory diseases, and all injuries. Adults who are overweight or obese consist about 52% of the population of city in Boston and 56 in Massachusetts. Other and this is a huge risk factor which can lead to other diseases and disorders like hypertension, diabetes, arthritis, strokes, and many others. This rate in the United States reaches the third of population, 36.5%. The percentage of people consuming healthy food like fruits and vegetables is about 26.4% in Boston and 28.6% in the population of Massachusetts. The percentage needs to be worked on since consuming such healthy food can decrease the risk factors for many diseases and cancers among population. There are many people are being treated for hypertension among the population of Boston. 71.3% of the population of Massachusetts, 75.3%. About 29% of the United States population were diagnosed with hypertension, and about half of them are under good control. The The prevalence of diabetes in Boston and Massachusetts are increasing in general between 1995 and 2005, while this rate among the American citizens is higher than these numbers, which is 9.3%. The cancer incidence rates among people of Boston are the highest for prostate cancer, female breast cancer, colorectal cancer, and lung cancer, while these numbers in Massachusetts are ordinary are prostate cancer, female breast cancer, colorectal cancer, and lung cancer.